Thank you all for being here. I'm Lisa Barrett. I'm an infectious diseases physician and a researcher, and I hope I'm a knowledge generator in research that brings knowledge back to people in a very special way. That's the way they want it, and that's one of my roles. And I struggled when I was putting together this presentation. I had an idea, and then I came closer to the time, and I was really challenged, and I was uncomfortable, but I had some hope. And so I hope to give you some of the same feelings as we wander through here, because let me be frank. Right now in Canada, and right now in Nova Scotia, we are not fully transforming healthcare or health systems, and we are biting at the edges of reimagination, and I think we can do more and better, and this is exactly the room to feel that. And so when I came back to Nova Scotia, I wanted to be what I kept saying to everyone else, a leader without fear. And we did that. There was an amazing team of humans that came to work around me. In the beginning, one of the first things we did was a study in prison, a clinical study in prison. And for those of you who are out there who know clinical studies, that comes with not the smallest amount of liability. And a group of people who never get a voice, those in corrections. And we did a clinical study there, and we did it well. And then there was a person living with HIV who needed a bone marrow transplant. And we offered that person a risky proposition to get a bone marrow that might actually cure his HIV. And at that time, there were only about 3 to 4 in the world. And in particular, there were only 0 that had been done in Canada. And we did that first here in Nova Scotia. And there were a lot of people who were very worried about this, and we had to get ethics approval very quickly, and we did it. We were leading without fear. So this was the team. I'm a tiny part of it, but we were leading without fear. And what we were doing was not just providing health care. We were not the provider. We were giving people without a voice a partnership. And that's something we don't do often enough anymore. And I will posit towards the end, and hope you come with me, that we can start to change the conversation from disease care by providers to health by health partners, because that's what I want to be. So what happened next? COVID. COVID happened next. I know you don't remember, but it was a big deal. And suddenly, this team of amazing, fearless humans that were working with me as health partners for people, both vulnerable and not, this team that had been walking on a leash institutionally, governmentally, it was like that retractable leash was let go. And we had an opportunity to work with community to generate something first in Canada and at times first in the world. I hope there are some folks here from Nova Scotia. I can't see any of you at the moment. All I see are bright white lights. But I hope some of you are from Nova Scotia, and you remember at the very beginning of that pandemic, from November of 2020 through to the end, we developed testing for COVID. And when I say we, I mean some people who were health partners, some researchers that were on our team, but most importantly, community. Community owned that. How often do you get to own a diagnostic test? Not just when you have symptoms, but to prevent you from getting sick or know if you should go to visit somebody else. 100,000 hours of volunteer work, 3 million tests, and over 5,000 volunteers. And the joy of that for me, and you might think it's because I'm an infectious disease doctor, was that everybody knew their status. Good thing to know. That was part of it. But the absolute brilliance of that for me was that people were doing this themselves, they owned it, and it was self-determination. We weren't providing anything. That was health, not just disease care, and it was health partnered with some experts, but led by community. And that is where I think we need to begin to reimagine and transform health and not just disease care. And we need to be risky about it. But at the end of COVID, it's not really gone, by the way. At the end of COVID, everybody who had been so uncomfortable with risk and change needed to get back to the status quo. We need to get back to the status quo. We need to get back to before. I'm like, did anyone know about before? Because it wasn't that darn hot. But yet, the retractable leash was retracted. And this brilliant, beautiful set of team members, experts, and community were put into the stall because no one knew quite what to do with them. And that's where I faltered. That's where I started to lose my fearless leading and where I got stuck doing this presentation because I wasn't quite sure what I was going to say next because we're still at the next part. And then I realized that there is a next part. And we can start to truly reimagine, and we can be transformative, and it's not just people in health that need to become partners, but everyone outside as well. And the outside is everyone. And I hope I challenge everyone in this room to do 3 things tonight and take home with you as you are your own leader in your own health, not just disease, as a partner, not a provider. Number 1, take risks, take them with your partners, but take them all the time. Be fearless and frank, because that's where I'm going to start going again, and I can't wait to do it. Find your sparkly people. There are lots of them around, and don't try and put them out. Let them sparkle, and I know there's lots of situations where we need to let people sparkle and shine. And don't forget that that's going to come with a lot of discomfort, and we should sit with it, and we've heard that already tonight. And the last piece is don't accept tidbits or nibbles on the end. Go for the full bite, truly reimagine, truly be transformative, live on the edge, and shift where we're going to head together for healthcare. And I hope you're just as uncomfortable, not quite sure, and totally hopeful as I am. Thank you.